Have you ever wondered how your body filters out waste and excess fluid? That's right, we're diving into the world of the urinary system, a marvel of biological engineering that keeps our bodies clean and functioning smoothly. Let's start with the foundations. The urinary system is composed of four main parts. First, we have the kidneys, a pair of bean-shaped organs that act as our body's filtration system. They sift through blood, removing waste products and excess fluid to produce urine. It's a non-stop operation, with the kidneys filtering an impressive 180 litres of blood every day. Once the kidneys have done their job, the urine needs to find its way out of the body. That's where the ureters come in. These muscular tubes transport urine from the kidneys down to the bladder, acting like the highways of the urinary system. Next up is the bladder, our body's storage tank for urine. It's a flexible organ that expands and contracts as it fills up and empties. When it's time to release the urine, the bladder contracts, pushing the urine out. Finally, we have the urethra, the exit route for urine out of the body. It's a small tube that carries urine from the bladder and expels it outside the body, completing the process of urine excretion. So there you have it, the ins and outs of the urinary system. From the kidneys to the ureters, the bladder and the urethra, each component plays a crucial role in filtering and removing waste from our bodies. And it is within this intricate system that urinary tract infections, or UTIs, can occur. So what happens when bacteria invade this finely tuned system? This is where urinary tract infections, or UTIs, come into the picture. UTIs occur when unwelcome bacteria gatecrash the urinary system, typically targeting the bladder and urethra. These microscopic invaders can cause a host of uncomfortable symptoms. Imagine a constant urge to urinate only to be met with a burning sensation every time you do, or the discomfort of lower abdominal pain, the uncertainty of cloudy urine, and the distress of seeing blood in the urine. These are some of the telltale signs of a urinary tract infection that many individuals unfortunately experience. While both men and women can contract UTIs, women tend to be more susceptible. This is due to the female anatomy, where the urethra is shorter, providing bacteria with a quicker route into the bladder. It's not a pleasant journey, but it's one that bacteria are all too happy to make. Now, you might think that a frequent urge to urinate is a minor inconvenience at worst. But let's not underestimate these infections. They can lead to serious complications if left untreated, such as kidney infections, which can cause permanent damage. So don't ignore these symptoms. UTIs are not just a nuisance, they are a serious health concern that require prompt medical attention. UTIs are a prime example of how something seemingly insignificant can disrupt the smooth functioning of our bodies. The bacterial invasion into the urinary tract is not just a minor disruption, but a full-scale assault that can have serious implications for our health. It's also worth noting that anyone can get a UTI, regardless of age or overall health status. It's not about being weak or unhealthy, it's about being human and having a body that, like all bodies, is susceptible to infection. As common as they are, UTIs shouldn't be taken lightly. They require prompt attention and treatment. So remember, if you're experiencing any of the symptoms we've discussed, don't hesitate to seek medical help. It's better to be safe than sorry when it comes to your health. After all, your body is your most precious asset. Keep it in top shape and it will serve you well. You might be wondering, am I at risk of developing a UTI? Well, the answer isn't a simple yes or no, as there are several factors that contribute to the likelihood of experiencing a urinary tract infection. Firstly, let's talk about female anatomy. Women are more prone to UTIs, primarily due to the short distance between the urethra and the anus and the urethral opening to the bladder. This close proximity allows bacteria from the large intestine, such as E. coli, to easily find their way into the urinary tract, thereby increasing the chances of an infection. Sexual activity is another significant risk factor. Intercourse can introduce bacteria into the urinary tract, leading to potential infections. Women who are sexually active tend to experience UTIs more frequently than those who aren't. This doesn't mean that men are off the hook, though, as they can also contract UTIs, albeit at a lower rate. Certain medical conditions can also increase your risk. For instance, conditions that hinder the complete emptying of the bladder, such as kidney stones or an enlarged prostate in men, can give bacteria a chance to multiply in the urinary tract. Similarly, people with diabetes or a weakened immune system may be more susceptible to UTIs due to a decreased ability to fight off bacteria. It's also important to note that UTIs are not exclusive to any particular age group. From young children to the elderly, anyone can develop a UTI. However, postmenopausal women and older men with prostate issues may be more at risk. So while this may sound worrisome, remember that understanding these risk factors gives us the power to take preventive measures. By knowing what increases the chances of a UTI, we can make informed decisions about our health and hygiene practices. Knowing these risk factors can help us understand how to prevent UTIs. It's easy to underestimate UTIs, but did you know they can lead to serious complications if left untreated? Urinary tract infections, or UTIs, may seem like a minor inconvenience at first, a little discomfort, a frequent urge to urinate, and you might think it's just a simple infection that will go away on its own. But let's delve into the deeper implications of leaving a UTI untreated. First off, if a UTI is not treated promptly, it can cause severe kidney damage. How does this happen? Well, the bacteria causing the UTI can travel up from the bladder to the kidneys. Once there, they can cause an infection that results in inflammation and swelling, which can damage the kidneys and impair their function. Kidney damage is not a light matter. Our kidneys play a crucial role in our body by filtering waste and excess fluid from our blood, which is then excreted as urine. If your kidneys are damaged, they may not be able to perform this essential function effectively, leading to a buildup of waste and fluid in your body. This can lead to a host of other health problems like high blood pressure and kidney disease, which could be life-threatening. Furthermore, UTIs can lead to a condition called sepsis if left untreated. Sepsis is a potentially life-threatening condition caused by your body's response to an infection. If the infection spreads to your bloodstream, it can lead to sepsis, which can cause organ failure and even death. So, you see, UTIs are not just simple infections. They can lead to serious, even life-threatening complications if left untreated. This is why it's so important to seek medical attention as soon as you notice symptoms of a UTI. Remember, early detection and treatment can prevent these complications. Don't underestimate the potential severity of a UTI. It's more than just a simple infection. So, how can you lower your risk of getting a UTI? Well, the key lies in 3 simple yet crucial steps: hydration, hygiene, and health checks. Let's unpack these a bit, shall we? First, staying hydrated is immensely important. Water, the elixir of life, plays a vital role in maintaining a healthy urinary system. It aids in flushing out toxins and bacteria from the body, reducing the chances of urinary tract infections. So remember to sip on that water bottle throughout the day. It's not just about quenching your thirst, but about keeping those unwanted bacteria at bay. Second, practicing good hygiene is paramount. This includes habits like wiping from front to back after using the toilet, which can prevent bacteria from the anal region reaching the urethra. Regular bathing and changing underwear daily also contribute to keeping the urinary tract clean and infection-free. And finally, regular medical checkups. These are crucial for early detection and treatment of any potential issues. A routine urine test can reveal a lot about your urinary health. And remember, catching a problem early often means a faster recovery and less discomfort. But don't just wait for symptoms to show up before you see your doctor. Make these checkups a regular part of your health routine. After all, prevention is not just about tackling the problem, it's about staying a step ahead. Certainly these steps require some effort and discipline, but when you compare that to the discomfort of a UTI, it's a small price to pay. And let's not forget the peace of mind that comes with knowing you're doing your best to stay healthy. These simple measures can go a long way in keeping UTIs at bay. So drink up, stay clean, and don't skip that doctor's appointment. Because, as they say, an ounce of prevention is worth a pound of cure. Scene script. Preventing UTIs is not just the doctor's responsibility, it's yours too. You see, the path to good health is a shared journey, and you're in the driver's seat. It's not just about reacting to symptoms, it's about being proactive in your everyday life. It's about understanding that your actions, your choices, and your lifestyle can significantly impact your health. Let's take urinary tract infections, for instance. Yes, they're common and yes, they're treatable. But wouldn't you agree that it's far better to avoid them in the first place? And that's where you come in. Picture this. You're a guardian of your body's fortress, and the urinary system is one of the rooms you're protecting. By maintaining good hygiene, you're ensuring the room stays clean and free from invading bacteria. When you keep yourself well hydrated, you're making sure the room's waste disposal system works efficiently, flushing out potential intruders. And by emptying your bladder regularly, you're not giving these unwanted guests a chance to settle and wreak havoc. But it's not just about these immediate steps. Think about your overall lifestyle, your diet, your habits, your physical activity. All of these elements play a crucial role in strengthening your body's defenses. A healthy diet supports your immune system, regular exercise improves your body's resilience, and avoiding harmful habits like smoking can reduce your susceptibility to infections. Remember, every step you take towards a healthier lifestyle is a step away from potential health risks, including UTIs. Your role is not just about reacting to health issues when they arise. It's about making choices that can help prevent them from occurring in the first place. Your actions can make a difference in preventing UTIs and maintaining a healthy urinary system. So take charge, be proactive. Your body will thank you for it. We've talked about the urinary system, UTIs, risk factors and prevention. Now it's time for you to act. You have the power to make a difference in your health. By staying hydrated, you help your urinary system function at its best. Good hygiene practices such as wiping from front to back and urinating before and after sexual activity can significantly lower your chances of developing a urinary tract infection. Regular checkups with your healthcare provider are also crucial. They can catch potential issues early before they escalate into something more serious. If you notice symptoms like a burning sensation during urination or an increased urge to urinate, don't ignore them. These could be signs of a urinary tract infection. Seek immediate medical attention to get the right treatment. By doing so, you're not just addressing the problem at hand, but you're also preventing potential complications in the future. Remember, your health is in your hands. Take steps today to prevent urinary tract infections and ensure a healthy urinary system.